But back inside Studio 1A, I'm Amy Robach along with Lester Holt. And coming up in this half hour, we'll have the latest on attempts to find a treatment decided about one drug that showed some promise. Then we're going to tell you about an Ivy League student who's been caught up somewhat in the immigration debate in this country. His name is Eric Balderas. He goes to haunt up with him. We'll have the latest coming right up. All right, plus we're going to look at some very lucky dogs. It turns out we're going to find out more about that in just a few minutes. All right, but first let's get a check of the weather from Bill Cairns, who is out on the plaza this morning. Bill, good morning.
I'll tell you what, Amy.
Bill, thank you. Well, the hope was that it would be a sort of female Viagra, helping women who complain of low sex drive. But on Friday, an advisory committee blocked the drug from moving on to the FDA for FDA approval, citing too many side effects. For more on the setback and the challenge of finding a drug to treat the problem, we're joined by Dr. Roshni Raj, medical editor of Health Magazine. Dr. Raj, good morning.
Good morning.
So the FDA advisory panel, there was no mistake, voted unanimously, 11-1, to not approve this pill. Side effects were mentioned. What specifically did they not like about the pill?
Well, they didn't like two things. One is it just wasn't that effective. In their opinion, the studies did not show great results. They did not show that enough women really got satisfaction from this pill, and there were plenty of side effects, including fatigue, depression, fainting spells, things that, you know, are significant and can really affect a woman's life. So if the pill doesn't work that great and it has a lot of side effects, it's just not going to get approved.
It had been hailed, obviously, as the female Viagra. We know that the little blue pill, the male version of Viagra, has been on the market now for 10 years. Yeah. Why is it so hard? If they've had 10 years, you know, to think of, well, how can we do the same thing for women?
Yeah.
How come no one's been able to figure it out?
Well, as we know, women are a lot more complicated when it comes
what are you talking about?
And, you know, Viagra works by increasing blood flow to the genital area. It's not that simple for women, and that's why it's really hard to come up with one drug or one pill that's going to help many women that have sexual dysfunction. You know, for women, there's so many factors that go into it. Psychological factors, stress, they just don't have enough time to even think about sex, they're not getting sleep. You know, it really is a multifactorial problem, so it's very difficult to come up with a medication that's going to address that.
How big of a problem is this for women? Do we know how many women suffer from low sex drive?
Well, that's the million-dollar question. There's a lot of controversy about that because, you know, even an individual woman, you know, their sex drive can sort of ebb and flow with different times of their life, things having to do with hormones or even circumstances. Some of the studies report about a 10% prevalence of sexual dysfunction, but a lot of those studies were actually sponsored by drug companies that have a vested interest in creating this issue. So it's really not clear. It is true that many women do complain that they don't have enough interest in sex. Some women don't have interest in sex and they don't complain. So do we call that a disorder? We're not really sure.
Right, and it's interesting you mentioned all of the reasons why it is more complicated to treat women who do have this disorder. That said, is it believed that a pill could be the answer? I mean, if we're talking about psychological effects, about not getting enough sleep, all of the things that go into it, could a pill change any of that?
Probably not for every woman, but perhaps for some. So there are some women that really do have some hormonal issues that affect their sex drive, and a pill may help. And testosterone is one of the hormones that a lot of people have looked at. There is a potential risk of cancer, so it hasn't quite come out yet. But there are avenues that people are exploring. I don't think a pill is going to be the answer for many women, but it may for a small subset.
They say if men clean the bathrooms on a regular basis and do some laundry, that actually increases a woman's sex drive.
I think so.
There's always that too. Exactly. Dr. Raj, thanks so much. Coming up, why a top student in the Ivy League was detained